We're the very first hospital in the state of Arkansas
to be recognized as a magnet hospital.
What we have achieved is what people are striving to achieve.
A magnet hospital is a center of excellence.
It provides a sense of security that they're receiving the best nursing care available in the state.
We're moving forward and taking this facility to a whole new level.
There's just very few hospitals in the world that are magnet hospitals. And as far as nursing goes in Arkansas, this is the best.
Alzheimer's disease is the most common cause of dementia, and it can really take a toll on a family and relationships. So to talk to us about that is Dr. Bushra Shah. She's with the Longevity Center at St. Vincent, and she's here to kind of give us some of the things that's a concern. A lot of families are on the lookout for it. They're worried. It's a terrible disease, and you're here to kind of put their mind at ease, or at least give them something that they can be on the lookout for.
Thanks, Janelle. I'm so glad that we're kicking off the month with talking about Alzheimer's. This is Alzheimer's Awareness Month, dedicated to for Alzheimer's and those who have loved ones that suffer from Alzheimer's. You know, it affects 5 million Americans in the United States. It is the 6th leading cause of death.
Really?
It is 1 in 3 senior dies of Alzheimer's. So, you know, researchers were trying to get a grasp on it, and a lot has been researched in the past 15 years. But it is a neurodegenerative disease. There is no cure for it yet, and it does progress.
So if I'm a person who has maybe an elderly or not even elderly, I mean, there have been several very public cases recently of people who we would consider young, you know, getting this terrible disease. But if I'm concerned about that for one of my loved ones, what is it that I should be on the lookout for?
The common symptoms for Alzheimer's, they can be divided depending on the stage of the disease, mild or moderate or severe. But in the mild stages, mostly it is memory loss. That is the first and foremost, and that's the biggest symptom that's attributed to Alzheimer's dementia. And, you know, repetitiveness, repeating the same questions, repeating the same conversations, getting lost, losing things, not being able to carry a multi-task job like getting dressed or unpacking and packing, in lack of hygiene, lack of personal appearance, being conscious about that, not recognizing familiar places, orientation to time is impaired, getting lost.
So it's just things that, you know, if you spend a lot of time with that person, things that they would normally be so sharp on, you would never really notice a difference. Something very commonplace for them all of a sudden seems like a much more difficult task.
It does, and you know, you might notice if somebody's grandma's their symptoms, they may, you know, they're always very well dressed, and suddenly they walk out and their shoes are not coordinated, or their makeup's all over the place, and that's not normal for them, or they keep asking the same questions. Those are some of the early symptoms to look for.
And you were telling me earlier, there's also some personality differences, you know, that you might have noticed with a grandma or a grandpa or, you know, mom or dad.
Yes, and that's most distressing to the caregivers. Some of the common personality changes: irritability. They can even get aggressive.
Really?
They can get depressed and withdrawn. They can become anxious, and with anxiety comes paranoia, not trusting people, lack of sleep. That is one of the worst symptoms that wears families out, that they pace all night. Spouses say, you know, we can't get any sleep because they're up all night. Then they're overly somnolent the next day. They're sleeping too much. And then loss of inhibitions. You know, somebody who's very conservative and modest might start having, you know, quoting sexual statements, or, you know, and that's not their fault.
Just
it's
uncharacteristic.
Yes.
So we don't know. Do we know what causes this disease?
You know, we could talk all day about all the research and the different causes, but just to briefly summarize, there has been a genetic attribution to Alzheimer's. There was one gene that was most commonly attributed to Alzheimer's, but there's been a recent study done in the past few weeks, actually, it's been released, over 15 countries with 7,000 individuals that were enrolled, and they found 11 new genes. And this is a very exciting breakthrough, because this will help us find more in terms of what's causing Alzheimer's. But there are other things that, you know, environmental factors that also contribute. High copper content or zinc content, heavy metals have been attributed to Alzheimer's. Then there is, you know, what's actually happening in the cell. I mentioned it's a neurodegenerative disease. So what happens is there's a protein called beta amyloid that gets deposited as plaques within the cells and just disrupts the cells.
Amazing. It's what I'm really fascinated about is the fact that we do keep progressing. Like you said, that new study, everyone is so determined to see if they can find at least the cause and then start working on a cure for this disease that just affects so many. And thank you so much for coming on the show and talking with us and bringing awareness to this, because like you said, that's what November is all about.
That's right. And, you know, we just need to focus on living healthy, eating healthy, and avoiding any environmental factors that we could to prevent this disease, because you cannot change your genetic makeup.
Sure, and you know, catching it early and seeing if you can start getting treatment then. Thank you so much, Dr. Shah. I appreciate it.
My pleasure.
Of course, the Longevity Center is always available for you, and you know, they have these great doctors there that you can talk to, someone that you can run these symptoms by if you do feel like a loved one might be in the early stages of this disease. Thank you again.